Good morning.
Bright and beautiful as ever.
Oh, thank you. Good morning, Apoku. How are you today?
I'm very well, thank you. Very well, thank you. So I'm looking through the glass, and earlier on it was quite dark and a bit greyish, but it looks as if the sun is breaking out here, you know.
Yes.
I don't know about you.
Same here. I've been out in the garden already, and it's absolutely amazing. The sun's not out yet, but I'm sure it's going to be out anytime soon.
Yeah. Anyway, I've just been going through the news, you know, from last night.
Yes.
Checking out if we've got any serious COVID stories, but it looks as if nothing much except for this story here that says that a single shot
Yes.
of either of the two main vaccines that we know about, the Oxford AstraZeneca one and the Pfizer BioNTech one, a shot of either of them will reduce the chances. It reduces the chance of needing hospital treatment by more than 80%.
Yes.
And my heart jumped for joy. I said to myself, "Oh God, that's good."
Yes, lots of
people in hospitals do it.
Yes. So yes, you did say we begin to talk about the Johnson and Johnson vaccine, and as you.
I wanted us to do this first. The news of the fact that just one jab, we're being advised that we need the second jab anyway to get sort of a fuller protection.
Yes.
But even just one jab of either of these two vaccines will reduce the chances of going into hospital by 80%, and I think that's amazing.
That is amazing news, and that's according to the US. They've been given the go-ahead, the Johnson and Johnson, to administer this vaccine in just a single dose, as you've been saying. All the other vaccines that have been approved thus far and has been in the rollout of the vaccination protocols worldwide is the Moderna, the Pfizer, and the BioNTech. And all of these have to be given in 2 doses. So this is fantastic news because it's given in 1 dose. So that means you don't have to wait for a second dose to have that immunity or have that vaccination, the antibodies or whatever you're going to benefit. The benefits in terms of preventing you from getting the virus and also preventing hospitalizations. I know you mentioned 80% against hospitalizations, but according to the Sky News, which I read, they said it's 100% effective. So it was 100%.
Johnson and Johnson one.
Yes, they said it was 100%.
That's not what I was talking about.
Oh.
I was talking about the Johnson and Johnson man.
Oh.
I was talking about the Oxford AstraZeneca and the Pfizer BioNTech
okay. Yeah.
jabs. And then they're saying in the news, breaking news, that a single shot of either of the Oxford AstraZeneca or the Pfizer BioNTech COVID jab will reduce the chance of needing hospital treatment by 80%.
Oh, so yes, you did say that. Yes, yeah.
So it's not 80% of immunity, but the needing of hospital treatment is cut down by 80%.
Well, that's still amazing. So coming to the Johnson and Johnson figures, so that's where I just wanted to make a distinction, was that it's 66% effective in preventing moderate to severe COVID-19 4 weeks after inoculation, and it's 100% effective in preventing hospitalization and death due to the virus. So that's a big difference. So the figures are different. You only get the Johnson and Johnson in 1 shot, as opposed to the other vaccines, Pfizer, BioNTech, and Moderna, where you get it in 2 doses, 12 weeks, within 12 weeks. So there's a huge difference. Also, there's a difference with the effectiveness and the immunity, as well as the in terms of preventing hospitalization. So it seems like Johnson and Johnson is extremely effective, reduces the risk of hospitalization, and provides that immunity. And also it's given in 1 dose. So it seems like there's a lot of positives with the Johnson and Johnson.
Yeah, but we don't have the Johnson and Johnson here in this country at the moment, do we?
No. So this is now being cleared in the US. So this is.
The government has ordered
Yeah.
But we haven't got it here, and it's just being rolled out in the United States. It's just been approved.
Yes.
Hasn't it?
Yes, just 2 days ago it's been approved. And what they're saying is they're still not sure about the variants. So despite all of these positive things, we still don't know how effective the Johnson and Johnson will be against the variants. So it's still early days, but it still sounds very promising.
All right, okay. The focus has shifted a bit because I was trying to get us to talk about this news here in the UK about the Oxford AstraZeneca and you know and the Pfizer BioNTech one, but now it's sort of shifted to Johnson and Johnson. Now,
I know, but just going back to your point, it is important to highlight and emphasize that 1 dose of Pfizer and AstraZeneca reduces hospitalization in over 80s by 80%, as you said. So it seems to be, so 1 dose of the Oxford or the Pfizer is highly effective in preventing hospitalization in the elderly. So this is still quite, good news, actually, especially for the elderly. And Matt Hancock obviously was quite happy about it. He said it's extremely good news. And also the Professor Jonathan van Tam, the Deputy Chief Medical Officer, has said that for England, that it's shown that for individuals over 70, both Pfizer and AstraZeneca jab, that there was an effectiveness against illness in approximately 60% after 1 dose. So it seems quite positive news anyway with that as well.
Right, okay, that's a story that caught my eye from the United States, and it's talking about there's some kind of threat, from the COVID variants, and the experts are saying that it's posing a real, the variants are posing a real threat to vaccine progress.
Yes.
And they're even warning that there could be a fourth spike.
Yes.
So it's saying here that the spread of highly contagious coronavirus variants is threatening to fuel a fourth potential surge of cases in the U.S. At the moment, it's just the U.S. you're talking about, but of course we all know that if it starts in the U.S. or for that matter, in any part of the world for that matter, it would spread. So
yes.
Where do we stand with these different variants and all that? It looks as if they're causing a bit of havoc here.
Yes, I think the uncertainty with the variants is obviously there's different variants. The ones that we do know about is, and that's in the news, is they're talking about the first detected in the UK, South Africa, and Brazil. We know the Brazilian variant is still very much a concern as it is now in the UK. The Center for Disease Control has predicted that the highly contagious, the B117 variant first found in the UK will become the dominant strain in the US this month. So as you said, it seems to be causing an alarm in the US. Obviously, other countries are getting concerned with the variants, but in the US, they are predicting that there will be a fourth surge of cases. And the head of the US Centers for Disease Control and Prevention, Dr. Rochelle Walensky, has said that it's recorded a very high number in terms of the number of cases, and they attributing this to the new variants which are spreading. So in terms of the variants, the concern is obviously the variants are highly contagious. They spread much faster. And also the treatments that we have available already might not work. So the vaccine, we're not 100% sure how effective the vaccines will be against these variants, as well as the treatments that we have, the medications and non-pharmacological treatments. So it is becoming a concern, even in the UK, that we know that the variant is obviously, there's still the concern in the UK for the Brazilian variant. So, I mean, I think there's nothing the only thing we can do is continue with track and trace. And I think that's the most important thing that we can do.
Variant that's coming to the UK, and the story about the 6 people.
Yes.
The track and trace.
Yes.
It's not really good. Hopefully that person is self-isolating somewhere.
Yes. Just to say that one of the news is Brazilian variant Sage advisor warns we might have to go backwards after lockdown opening because of this variant. So the government advisor is saying that there's a warning that there's a risk the country might have to go backwards after national coronavirus lockdown is eased. So from the SAGE, the Scientific Advisory Group for Emergencies, came as the first cases of coronavirus concerning the variant was detected in Brazil, which is now found in the UK. And as you said, the Public Health England said on Sunday that 6 cases of the variant may spread more rapidly and may not respond to the existing vaccines that were found. So 3 cases were identified in England and 3 in Scotland. So they are still concerned about it. So we're going to have to just look from the guidance from the government, because I think what they're going to be doing is that they're going to be monitoring the situation. So I think it's going to be a lot of testing, tracing, people still having to adhere to the guidelines of social distancing, wearing a mask and hand sanitizers, and obviously working as much as they can from home. And then schools are opening on the 8th of March, so we will probably hear about how that's going to be managed more closer to the time. But it definitely seems that I think they're going to be holding a meeting today to discuss. Matt Hancock and Downing Street Boris Johnson will be holding a meeting together with all the MPs from all parties to discuss the new variant and to discuss the effectiveness of the vaccines, and how they're going to manage the situation. So the one that they're concerned about, the variant, we spoke about the UK variant, but the P1 is a Brazilian variant. And they are also concerned about this variant, the Brazilian one, which has been found in 6 cases. So
Yeah, sorry. It seems as if this Brazilian variant it's a super spreader. It's spreading quite fast, and we, here in the UK, we'll have to be really careful. And kudos to the authorities. I think they're doing their best to contain the situation. But we also need to play our part by not continuing to adhere to the rules.
Yeah.
To wearing of face masks and cleaning, washing our hands and sanitizing,
Yeah.
blah blah blah, and all that. Right. Another vaccine story. Some EU countries were not. There was this situation with the AstraZeneca vaccine, but the French government says that older people with pre-existing conditions can now get AstraZeneca's COVID-19 vaccine, revising its stance on the issue. Before, they didn't want to give it to them, and to quote the health minister, people affected by comorbidities can be vaccinated with AstraZeneca, including those aged between 65 and 74. Last month, France approved use of the vaccine for under 65s only, citing lack of data for older people. So, but since then, studies have shown the jab is highly effective among the elderly. So France and other countries in Europe, they were not too sure about giving the vaccine to people older than 65, but the good news is that they've approved it now and they're going to start using it.
Yes. So, I mean, that's good news, actually. Very good news in terms of the vaccines and in the elderly population. And also that vulnerable people can now get the vaccine also with underlying conditions. So I think that's really fantastic news, actually.
Yeah. It is great news. Now, you see, the thing is that things are beginning to quiet down a bit. There's not a lot to talk about on this particular segment of the show. We used to start talking about it, and there was not enough time. Sometimes we went over about 15 minutes and all that.
I know.
Here we are.
I know. But Yeah, no, I know. Definitely. It's looking really promising. And actually, I wanted to start off by saying the numbers have gone down. So, we're seeing 104 new deaths in the UK. Obviously, every life matters, but the numbers have reduced. The number of deaths in the last 24 hours in the UK has reduced to 104 deaths. The number of new cases has reduced to 5,455. And we know that um, the rest of the world in terms of the worldometer, the figures I'm going to read now, if that's okay, is 115 million and 3,270 positive cases globally.
No, it's more than that. If you refresh your page,
Oh, okay, maybe I needed to refresh.
The last bit is 510,
yeah, it's 510. So 115 million, 3,510 positive cases. Number of deaths globally is 2,550,494 deaths. Total recovered is 90,728,353. So definitely it seems like things are beginning to look a lot more positive. In terms of USA's number one with 29,314,254. Total number of deaths is 527,226 in the US. India number two with 11,124,527 positive cases with 157,275 deaths. Brazil is 10,589,608 positive cases with 255,836 deaths. Russia, number four, with 4,257,650 positive cases with 86,455 deaths. And UK is 4,182,009 positive cases with 122,953 deaths. And just to say that Brazil is number 3 in the world and number 2 in terms of the deaths. And that is why it's such a concern with the Brazilian variant, because it is spreading faster. We have seen large numbers of deaths in the Brazil. And if this Brazilian variant spreads in other countries, we're definitely going to see, obviously, the fourth surge, as US is warning us about. In terms of the other countries, number 16 is South Africa with 1,513,959 positive cases with 50,077. We know that South Africa has gone into level 1 alert, and the rollout of the vaccines has continued with good effect. And then the other countries that we're looking at is Nigeria, just to mention, as you wanted to know about that yesterday as well. So it's 156,017. They're number 74. Oh, sorry, number 73 in the world.
Oh, 73, I can say, yeah.
And 1,915 positive deaths. And then Ghana is number 88 with 84,023 positive cases and 607 deaths. So yes, as I said, UK is definitely looking extremely positive. I mean, the fact that our figures have gone down, we're definitely going to see improvement in the figures, reducing, and also the number of hospitalizations reducing as well. So it's definitely good news all around, I would say. But it would be obviously important to see how things will change when we start to reopen schools. So that will obviously affect the figures, I do think, because obviously it's going to be a lot of managing the situation. But as it stands, UK, over the last 24 hours, only 104 deaths, which is a significant reduction from.
And when you were doing the Ghana numbers, I wanted to chip in to say that yesterday, just yesterday, the president and his wife, and then the vice president and his wife, they took the jab.
Oh wow, wonderful!
Publicly, and they've rolled it out completely now. And according to the information I have, they're going to start, of course, with the frontline workers, the policemen, and the army, and then the so on and so forth. So that's really great news.
Fantastic.
Now, another country that caught my eye this morning is Mexico.
Yeah.
And Mexico, they've got the number of deaths is really, really huge. It's 186,152, which probably is number 3. And hang on, no, it's not. It's even. Let's see. So the US is number 1, and then Brazil is number 2. Yes, and then Mexico is number 3.
Yeah.
Even before India. So it's but in Mexico they've started vaccination now.
Yeah.
They've rolled out vaccines and people are taking the vaccines and all that. So hopefully it's going to come down.
Yes. Well, that is a concern.
When I saw the figures.
Yeah, I mean, to think that the numbers are it is a concern, because you think that it's number 13 in the world on the Worldometer, Mexico.
Yeah.
They were high up earlier on, but they've gone down in terms of the numbers. But in terms of the number of deaths, they're number 3 in the world. So that is significant. So definitely it is a concern in Mexico. But hopefully with the rollout of the vaccine, we'll hopefully start to see the numbers reduce as well. But yeah, those are the figures as of today. Definitely it sounds more positive. And hopefully, I think we're going to start seeing more and more numbers reduce, and there's going to be less to report on the COVID-19. Yeah.
And then we can do other things now.
Exactly.
We can go back to what we were doing,
on mental health. Yes.
Cases and all that. Well, not cases, but,
yes.
mental health stuff and other things.
Yes.
Diabetes, this and that. Yeah. So, yeah.
Yes.
Thank you very much, Dr. Seshini. I can't believe that it's only, we've finished with everything in 22 minutes. That's
I know,
amazing.
we've got loads of time. Can I just say happy birthday shout out to Alana? It's Ferdinand's niece, our niece in London, in Essex. So happy birthday. It's Heinrich, Ferdinand's brother's daughter. So happy birthday to her, and hope she has a wonderful celebration. It was also another nephew's birthday, Keegan, over the weekend. So happy birthday to him as well for Sunday. And as I said, it was Sukanisha Summer's birthday as well. On the Saturday, so happy birthday for that. So yeah, lots of celebrations, and tomorrow it's Heinrich's birthday, so I'll give him a shout out tomorrow. So everyone that's celebrating birthdays, I mean, March seems like a very popular month for birthdays. I'm not sure why. It's my birthday month as well.
It was February, because I don't know, because throughout this February, the one WhatsApp platform on which I belong,
yes.
Every single day someone was celebrating their birthday.
Yes, February and March seems to be very popular.
Was supposed to be on the
9th.
their leap
Yes.
birthdays, yeah. So yeah. Anyway.
So what do people do then for the leap year? Do they just celebrate it every 4 years?
I don't know. I asked my friend whose birthday falls on a leap year, and he says that he celebrates it every year.
That's good.
Either on the real date or after.
I would celebrate it on the 28th and the 1st if it's not a leap year. I'd celebrate it on both days.
Why not?
But yeah, happy birthday to everyone, and have a fantastic day. And yeah, I see Hospital Radio Bedford, you're up for an award.
Yes, we are. Yes, we are. Fingers crossed we'll win it. It's an amazing job with these amazing people that I work with.
Well done to you and to the team.
Great.
Well,
especially to Andy, who put everything together and sent it to the HBA. Andy Norbury, well done, guy. And well done to every single presenter here. Today is Tuesday, isn't it? So from after this show at 8 o'clock, and after the news on the hour, the Godfather will come with the Godfather's Good Morning Show. Because today's Tuesday, he calls it Tuesday. So if you have any tune in mind you want played for you or for somebody, just contact the Godfather's Good Morning Show page, Facebook page, and then just put it there. And then after him, we'll have Jeff Clark from 10 to 11 with Coffee Break, and then the James Murray's Midday Match from 3 hours solid live music, live show from 11 Jeff Clark brings us the Motown Magic, which is a recorded program. And then Barry Captain Day, amazing man, amazing broadcaster. He follows suit with Barry's music mix from 5 to 7. Then we have our flagship show, the Hospital Radio Bedford Community Services Information Show from 7 to 9. Followed immediately by Tuesday Late with Mick Levitsky. And then we I wouldn't say round off because it's a 24-hour radio station. But then from 11 to midnight, we have Sounds of the Big Band with our own Frank Palmer. Proper packed, schedule. So just keep your dials where they are, 24 hours a day. We will serve you. And thank you very much, Dr. Seshni, for being a part of this amazing platform that's spreading good news and educating and entertaining at the same time.
No, thank you so much, Apoku. And I hope you all win the award because you all are amazing, amazing presenters. I absolutely love Hospital Radio Bedford, and to be part of it is amazing. Well done to you and the whole team, Jeff White, yourself, and everyone else that presents, and everyone at Hospital Radio Bedford, because you've done an amazing, amazing job, and especially during the pandemic, covering such amazing stories, including Sir Thomas More's stories and his funeral, and you're doing the 24-hour service, and dedications and condolences. It's been absolutely amazing to be part of this, such an amazing broadcast team. So I'm truly, truly grateful, and I'm rooting out for all of you that you win the award.
Thank you very much, and have a fantastic day.
You as well. Let's spread the love and not the virus. And let's face it and not fear it, as we've been doing. And see you again tomorrow, bright and early. And again, happy birthday to everyone that's celebrating: Alana, Heinrich, Vishal, and Shannon as well. And also to Sukanisha Sama and Keegan. So many birthdays to celebrate. I'm looking forward to it as well.
Right, thank you. Right.
Thank you so much, everyone, for joining the Hospital Radio Bedford, and lots of love from me to your family, and namaste. Stay safe, everyone. Goodbye, and have a fantastic, fantastic day.